Welcome to the GFY podcast by healthcare professionals providing insight on how to navigate your health so that you can go fix yourself. The GFY podcast is hosted by Mike Bruno, a chiropractor and athletic trainer, and me, Michael Stant, an athletic trainer certified strength conditioning specialist. Although we are healthcare providers, we are not your healthcare provider. We will discuss general health interventions in this podcast, but you should not take that as health advice that works in every situation. Before doing anything on your own or making any lifestyle changes, please consult with your own physician. This podcast and the views expressed here are separate from our full-time jobs and are strictly our own opinions. If you are enjoying the GFY podcast, please leave us a review on your listening platform and consider subscribing to our podcast on YouTube. Links to our show can be found in the show notes on whatever platform you are listening to. Just a quick note on format. This episode and future episodes released on Saturdays will be solo episodes by me. I'll be using this time to review a specific health intervention, a wellness topic in depth, or to give some insight on something in the news that is getting coverage, and try to review the actual research and science behind it. These episodes are designed to be short, 10 to 15 minutes, to help you learn something interesting or gain some insight into why a specific treatment is used. And honestly, it gives me an opportunity to learn a little bit as well. Today's episode is inspired by a recent social media post I saw concerning Phillies all-star Bryce Harper. Shout out to my friend Pat for sending it to me. In a report by John Clark, Philly sports columnist, he shared a picture of Bryce Harper hooked up to a machine with IVs in each arm. Honestly, it looked like dialysis, which is a treatment typically reserved for kidney disease. But what Bryce is actually having done is extracorporeal blood oxygenation and ozonation. Since that is a mouthful, you will hear me refer to it as EBOO for short. In this episode, I'm going to review what EBOO is and how it works, review the claims about its benefits and what research actually exists, and I'll end with my verdict on whether or not this treatment is worth it. So what is it? Let's break it down by the name. Extracorporeal means happening outside of the body. Blood, well, we know what that is. Oxygenation means exactly what you think, adding or enriching the blood with oxygen. And then ozonation means adding ozone into the blood. Now, ozonation is typically done to treat water, to purify it, disinfect it, and kill pathogens. So when you combine the words together, what you get is blood oxygenation and ozonation occurring outside of the body. So how does that happen? To make this process work, the person getting it done will have two IVs inserted, typically one in each arm. Blood is drawn out of one arm and fed into a machine that acts as a specialized filtration device. Inside that device, two main things happen. Waste products are filtered out of the blood. An ozone generator pumps a mix of oxygen and ozone into the blood. Now, ozone causes a cascade of chemical events in the blood, but I'll touch on those proposed mechanisms in a minute. Once this process takes place inside the machine, the blood is returned to the body via the other IV in the other arm. So what are the claims? Why are people doing this? As I mentioned before, ozone is used to help disinfect and purify water. Proponents believe it can do the same thing in your blood. The claim is that it can kill viruses, bacteria, and fungi in the bloodstream. Furthermore, longevity experts who are obsessed with mitochondria believe that EBOO can help stimulate mitochondria and increase ATP energy production. One last possible effect is that it calms the cytokine storm, meaning it creates a reaction that actually reduces systematic inflammation. Because of this proposed ability to treat chronic inflammation, it has been linked as an adjunct therapy for diseases such as fibromyalgia, Lyme disease, autoimmune disorders, circulatory issues, and even long COVID. And because of these mechanisms, some clinics offer it as a treatment option for healthy individuals as a possible longevity hack. So where's the research on this? Honestly, there's not much. I did a brief search for systematic reviews and a general Google Scholar review, so, is what it is. I found two whole research studies. Both were done in Italy. Both have the same principal investigator, Dr. DiPaolo, and both of these studies are over 20 years old now. The first study really just kind of reviewed the biological implications of the therapy. In its conclusion, it found that the therapy can activate the immune system in infectious diseases. It suggested it could stimulate the release of growth factors and potentially reduce ischemia, which is lack of blood flow, and vascular disease. It also reported that it was able to activate the immune system in cancer patients and kill cancer cells. However, these specific cancer claims had not been verified in humans at the time of the study, and there's no further studies on that. The second study was a controlled trial on patients with peripheral artery disease, or PAD. PAD is a narrowing of the arteries, especially in the legs, that limits blood flow. In severe cases, this leads to slow healing sores and lesions on the feet. In this study, they compared EBOO against standard therapy at the time. The result, it did improve the healing of distal lesions, but small sample size tests. There's only about 10 people in the treatment group, 14 in the other. There's no true control group. There was a more recent article in 2023 reviewed the biology of the treatment, and once again, it showed the effectiveness in treating wound lesions and serious infections like MRSA. But again, this research out of Italy, nothing really done in the US that I could find. And that's it. There is virtually no research on the efficacy or truly the safety of this treatment, especially here in the US. It is not approved by the FDA for the treatment of any disease. As a result, this is not covered by insurance. Typically, a treatment takes 45 to 60 minutes, and it costs anywhere from $1,000 to $3,000 per session. And remember, because it is not FDA approved, it is not heavily regulated, there may not be a standard safety protocol that every clinic follows. So, a quick side note here. One thing, although I focus on the extracorporeal method, the blood filtering machine, ozone has been used more recently via injection directly into joints and muscles. Intra-articular and intramuscular injections of oxygen and ozone for musculoskeletal pain have actually gained traction lately. Some literature exists utilizing it for low back pain, knee osteoarthritis, and tendinopathy. All the reviews often have poor methods and show some bias. Most have been shown to be safe and can aid in pain control in the short and medium term. So in summary, this is what we've got on EBOO. How it works. It takes blood out, filters it, adds oxygen, ozone, and puts it back, hoping to quote-unquote disinfect the body and stimulate an anti-inflammatory response. It is a potential adjunct treatment for chronic diseases that has some biological theory behind it. The research is extremely lacking and mostly limited to peripheral artery disease. The cost, quite expensive, not FDA approved, high cost. So here's my take. If you have chronic disease and the traditional treatments are not working, talk to a doctor about the potential of using EBOO. If you are an everyday person looking to get healthier, do the no-cost things first. Sleep well, eat clean, exercise, get some sunlight. If you're someone doing the healthy things already and you have the discipline to keep doing them, I would guess this won't make much of a difference for you. Now, if you're Bryce Harper and you're fine pissing away $3,000 on an unvalidated treatment to maybe get a few more hits or home runs, then sure, go for it. If it helps him, great. My final verdict, EBOO or any form of ozone treatment should not be the first option in treating pain. It is something that should only be considered after all other traditional treatments have been exhausted. In healthy individuals, it is probably not necessary. I hope you enjoyed this brief review on extracorporeal blood oxygenation and ozonation. If you enjoyed this episode or any other episode of the GFY podcast, please leave us a review on your favorite listening platform or YouTube. If you haven't already, please subscribe or follow us. You can find links to our socials in the show notes. We also have a newsletter called Well Informed, which goes over many of the topics we review in the podcast. If you prefer reading over listening, please subscribe to the newsletter if you have not done so already. There will be other topics reviewed in there that will be exclusive to the newsletter as well. Have a great day.